Welcome to ACR On Air, the official podcast of the American College of Rheumatology, where we have engaging conversations with leading rheumatology professionals on topics such as the latest research on rheumatic diseases, solutions for addressing practice management issues, legislative policies impacting patient care, and more. Here's your host.
Welcome back to another episode of ACR On Air, the official podcast of the American College of Rheumatology. I am your host, Dr. John Hausman. Show notes for this episode can be found at acronair.org. You can find previous episodes on Apple Podcast, Spotify, Google Podcast, and on your favorite podcast app. While we dedicate many podcast episodes to discussing rheumatic diseases, this episode will be focused on the opposite of disease, that is, on wellness. Wellness includes the things you should do to stay healthy, rather than the medicines you need to take once you're ill. Wellness includes things like physical activity, nutrition, sleep, and mental health, things that are of utmost importance to patients, but which we often avoid discussing during our clinic visits. We invited Dr. Christina Downey to discuss her ideas for healthy living. The thing is, she really knows what she's talking about. Not only is she a practicing rheumatologist, but she is board certified by the American Board of Lifestyle Medicine. And I kid you not, that board really exists, and they follow evidence-based practices to help treat, reverse, and prevent chronic disease through lifestyle change. We'll discuss how to counsel patients about these topics, and she provides practical, small steps that patients can take to improve their wellness. We also discuss tips about staying healthy while juggling a clinical practice and administrative responsibilities in family life. We discuss empathy, including what it is, how to get it, and why you want it. And lastly, Dr. Downey talks about why she's been involved in advocacy for many years and how that may help to fight burnout. Dr. Downey is Associate Professor of Medicine in Rheumatology at Loma Linda University Health, where she is the interim chief of that department. In addition to certifications in rheumatology and the American Board of Lifestyle Medicine, she's a certified densitometrist to read all your DEXA scans and is also certified in musculoskeletal ultrasound. She's the current chair of the Government Affairs Committee at the American College of Rheumatology and one of the Young Physicians Section representatives to the American Medical Association. Locally, she's the program chair for the Southern California Rheumatology Society. Yeah, of course, she had to live in California to practice lifestyle medicine, right? And when not working, she likes to explore new cultures by traveling with her family, go on outdoors adventures, and read. Enjoy the show. Christina, welcome to the show.
Hi, thanks for having me.
So you have a blog, and you describe yourself as a rheumatologist passionate about healthful living and helping people make the best choices for their health. And in your blog, right above that quote, you have a picture of something that looks like overnight oats, and then you have a picture of a canoe and a picture of a pair of hiking shoes. And, as a rheumatologist, I would have thought you would have put, pictures of methotrexate pills and maybe a glucocorticoid injection or perhaps x-rays of the hands. And I sort of wondered how those pictures reflect your idea of healthy living.
Yeah, absolutely. So I do not discount the role that methotrexate and traditional pharmaceuticals play in help keeping rheumatology patients healthy, but there's so much more to patients than just their disease. And so my philosophy on medicine is that I try to care for the whole patient and not just the hands by looking at x-rays. I also ask them about their life, how they're sleeping, how their relationships are going, how they're feeling on a day-to-day. And, methotrexate is great, but it really doesn't have a huge impact on a lot of these things.
And tell me a little bit about your experience in how you became interested in sort of this idea of what's called lifestyle medicine.
I grew up in California, so I'm probably a little bit crunchier than some of our listeners might be. But it's been a passion of mine my entire life. I grew up interested in nutrition and exercise, and the older I got and the more exposure to medicine I got, the more that was reinforced.
Hmm.
Through medical school, I saw people who, through no fault of their own, had illnesses, but I also saw people who probably could have prevented a lot of their illnesses, like the COPD ward. Everyone pretty much was a smoker on that ward, and a lot of people still continued to smoke despite being hospitalized repeatedly for COPD. I saw people with alcoholic cirrhosis who, as soon as they left the hospital, would go back to drinking. And you can argue that alcoholic cirrhosis is a completely preventable disease.
Sure.
So there are diseases where, through no fault of their own, people develop them, like our diseases, rheumatoid arthritis, lupus, vasculitis. Nobody did anything to develop these diseases. However, I do think that their health could still be enhanced by adopting healthy living practices, in addition to taking the medications that we know save lives and decrease morbidity.
That certainly makes a lot of sense. And, you mentioned smoking, and certainly there's a increased risk of rheumatoid arthritis among smokers. So maybe this idea of healthy living does fit right into rheumatology and what we do every day.
Absolutely, yes.
And so in addition to your sort of sense about the importance of lifestyle, have you had any additional training in what's called lifestyle medicine?
I have actually. I was able to become certified by the American Board of Lifestyle Medicine by submitting case reports of patients who I've been able to help through health coaching, as well as through training, attending a certain number of CME events, and passing an exam.
Oh, that sounds fantastic. So you're the perfect person to talk about these things. So let's begin a little bit about exercise. For all of us, exercise is something we should be doing, but probably don't do as much as we should be doing because of other commitments. But how do you discuss the importance of exercise with your patients, and how do you actually get them to move when, they usually have other things going on and they may be in pain? And right now in wintertime, it's snowy, and at least here in Massachusetts, it's snowy and ice. Those are things that you probably don't see much in California.
Well, I do have quite a few patients who live, as we call it, up the mountain. And so they do have
Aha.
snow. As you point out, many of them don't have sidewalks on their roads. So it's not safe for them to walk. And if I have patients with osteoporosis with a high fracture risk, I'm not going to encourage them to go tramping through the snow without sidewalks and then have them fall and break their hip. So I first want to acknowledge that the ability to schedule for, think about, undergo an exercise program is certainly one of privilege.
Hmm.
And many patients are working multiple jobs, or they're the sole caregiver of a spouse or a parent or a child, or they're just dealing with trying to get their basic needs met. And so exercise is the last thing on their mind. And I completely respect and understand that. And so coming from that place, what I'll typically do is I'll ask patients, tell me about your day. What's a typical day for you? And then I listen for, maybe they're already waking up and going to the gym. Maybe they're going to yoga. Maybe they're gardening. Maybe for their work, they're very active and they're getting their recommended exercise just by the nature of their work. And that's great. But when I do hear that patients spend a lot of their day sedentary, then I ask them, what are some things that you enjoy doing? And then typically I'll be able to coax out of them a way that they can become just a little bit more active, just move a little bit more. Not everybody's going to hit the CDC guidelines of 150 minutes a week, and that's okay, because every incremental increase in the amount of time and exertion that we're spending on just moving our bodies, there's going to be a benefit from that. And so perfection is not the goal. Just a little bit better is the goal.
Yeah, so gradually improving or engaging in more physical activity over time. I think that's very reasonable. And what sort of ways do you have people who aren't going to the gym? What sort of ways do you have them incorporate exercise in their daily lives?
So we have again, the privilege of great weather most of the time, but we probably have the opposite problem where in the summertime, it can be too hot to get
Hmm.
outside during the heat of day. And, of course, people might not live where it's safe or where they have access to green space. So for those patients, I ask them if there's a mall or anything close by where they
Hmm.
can go and walk. I also ask them, do you have friends in the neighborhood who you can walk with to feel a little bit more safe?
Hmm.
Some people walk their kids to school. So I say, well, maybe if you walk your kids to school, you can walk an extra block and then turn around and come back. So just adding a tiny little bit. Some people have access to a YMCA where they're able to get into a swimming pool because their knees hurt and they can't walk, or they don't have an exercise bike at home. But a lot of times, YMCAs will have a sliding scale for membership, or I'll be able to steer them to their health benefits to see if their insurance covers any type of exercise fee waivers for gyms in their area. So we try to get resourceful.
That's great. And I love the idea of the mall. I remember I had a patient with rheumatoid arthritis that every time I saw her, she would bring down a list of how often she went to the mall and how many laps around the mall she would do with her husband. And it was a great way for her to stay active, even in the wintertime, because the malls are probably live at 70 degrees, which is a pretty nice temperature. What sort of benefits are expected to be seen by patients who engage in exercise? Is it just that it makes you, the provider, feel better, or do they actually feel better or get any benefits from this additional activity that they're doing?
Yeah, absolutely. I'm sure you've heard this before. I have no idea who to attribute it to, but if you could put exercise in pill form, it would be the very best medicine that we have available. So, what I see is people who are very tenuous in their functional status. So, they haven't adopted an exercise regimen for most of their lives. And it's kind of a struggle for them to stand up out of a chair on their own. I worry about their ability to stand up if they fall down.
Mm.
How long are they going to be laying there if they're unable to even stand up from a laying position? So I start with goals like that. I just saw a patient actually last week who didn't do any exercise at all, and she was able to stand up out of a chair. She was a woman in like her mid 70s, and I was trying to help her understand her transverse abdominis muscle. And I explained
Mm.
that if she laid on her back and tried to imagine the sensation of her belly button going back to her spine. And she's like, well, if I lay down, I can't get up. And I said, perfect. We now have a goal for you. So I actually ended up referring her to physical therapy, which I think is probably underutilized, with the diagnosis of sarcopenia and decreased functional status, which may or may not have been the truth. But if you're unable to get up from the ground, I think that's
Yeah.
probably fair. She is now working with hopefully she will be working with physical therapy to try to work on what things she needs to do specifically to be able to meet her goal of just being able to get herself back up from the ground if she does happen to fall.
Yeah, I think that's hugely important. I think it may help weight loss and with blood pressure, and probably there's some mental health benefits from engaging in exercise, or at least, I certainly feel that when after I go for exercise, mind feels a little bit clearer than it did before going for a run.
Yeah, absolutely. And I don't have any studies in front of me, so I can't quote you a number, but I know that research has been done looking at people doing medication for depression versus exercise for depression. And the endpoints tend to be the same. I've read a few studies that have looked at this. So I'm not saying that people should not take medication if they need it. And I'm certainly not saying that if someone feels depressed that they should just go to the gym and not talk to a therapist. I'm saying that they probably need to approach this from a multi-pronged approach, but adding exercise to working with a therapist and taking any medications that one might need would probably give them that extra boost. I agree. When I wake up just a tiny bit earlier and do a yoga class or go for a run or ride my bike, I definitely feel more put together the rest of the day. I'm happier. I have higher levels of gratitude. I just feel more accomplished that day. So it definitely helps my mental health for sure.
Great. Now let's switch topics a little bit and talk about that overnight oats or whatever it was on that picture, nutrition. So the first question is, was that really overnight oats? And the second question is, how do you counsel patients about nutrition? A lot of patients come to me saying, what do I need to eat, to get rid of my rheumatoid arthritis or lupus and things like that? I probably tell them, there's probably nothing, but I wonder what your approach is for this.
Absolutely. So that was not overnight oats in the photo. That's actual oats.
Oh, okay.
Old school Irish oats made on the stove.
Got it. Okay. Is that's actually a dish that you made?
That is, yes.
It looks delicious, whatever it was.
Thank you. I love oatmeal with berries. My husband often accuses me of working for the fiber lobby or the whole grain council. So again, same thing with nutrition as with exercise. Nutrition is not going to cure anything. I often get this, well, should I not eat nightshades? And what should I not eat? And what should I eat? And people have a lot of anxiety around this and want a lot of information about this. And my thoughts on that are that nutrition is something largely that you can control. Again, with the caveat of not everybody has access to grocery stores. Not everybody has access to fresh foods. And so if you're living in a food desert, if you are trying to feed a family on the SNAP program or otherwise food insecure, obviously this advice is not going to be quite as helpful. And so I do want to acknowledge that. But for the people for whom this is a concern, I do believe that nutrition is something that is largely within our own control. And so we feel like this thing that's large and outside of our control, we can wrap our arms around it and we can do something. Like I said earlier, aside from smoking and other exposure things, UV rays, a lot of our patients have come by their diseases honestly, meaning that they didn't do anything to deserve them. They're lifetime diseases. These are chronic things. We don't have a cure for it. That can be really, really scary, especially if you're 25 years old and you were told that you have lupus and that you need to go to the doctor every 3 months and you need to have blood draws and urine tests every 3 months and you need to take all these medicines and they have to be on an empty stomach and you're going to take this prednisone that's going to change the way you look and feel. That's really scary. And that can feel like we are on a trajectory that's careening out of control. And so to be able to say, well, what can I do? What can I eat? What can I not eat? How can I get rid of this by doing something that is easy for me to do? So I totally get the impulse. So with nutrition, I approach it from the same way that I approach exercise. What are the things you like to eat? What do you eat in a day? What's your favorite fruit? What's your favorite vegetable? The vast majority of Americans are eating too many hyper-processed foods. Mm-hmm. We're not eating enough fruits and vegetables. And I'm guilty of that as well. I don't get the recommended fruits and vegetables every single day. Sometimes I'm busy. Sometimes I'm traveling. Sometimes I just want pizza for dinner. So trying to change those things as well as whole grains and fiber. Most Americans, because they are eating hyper-processed foods and they're not getting the recommended amount of fruits and vegetables, they're often not meeting their whole grains or fiber goals. So those are the 3 levers that I try most to toggle. The other thing nutritionally related is alcohol. Some people may still have this notion that a little bit of alcohol is healthy. This has since been debunked, and no amount of alcohol is actually.
I was so depressed when I heard that data.
I know.
That glass of red wine is no longer a good thing, but it may even a little bit of alcohol cause harm. It was a big bummer.
Yeah, I agree. I do enjoy a good finger or two of whiskey now and then, and it did make me sad. But it's a lot of empty calories, and people don't tell you unless you ask them. And you might be able to knock off 500 calories and however many grams of sugar from someone's diet just by having them scale back a bit on how much they're imbibing.
Yeah, especially in relation to potential side effects from methotrexate. Alcohol may not be the best thing. And I think you're absolutely right. The recent data show that no amount of alcohol is good. But certainly, I think people are not advocating going cold turkey and just cutting out alcohol altogether, but just less is more. That if you try to limit the amount of alcohol you drink that might actually prolong your life.
And these things are like a pendulum, right? Like things come, things go. What we believe as dogma now may be shown to be disproven 10 years from now. So who really knows? But what I would tell my patients or my colleagues is that, if you enjoy a glass of red wine, have a glass of red wine, but savor it, sip it, really enjoy the experience. Don't drink it in 2 seconds and pour another one. So just like my pizza or, the cookie that you're going to have or whatever, like have it. That's fine. You need to enjoy your life, and balance is very important in all things, but savor it, enjoy it. Don't watch TV and mindlessly shove pizza in your mouth. Sit down at the table, take a bite, really feel it in your mouth and enjoy the taste.
And often people ask about certain diets like the Mediterranean diet or the paleo diet, intermittent fasting. What do you tell people when they ask you about those types of diets?
Yes. So I go through my pendulum spiel about how what we believe to be true now may be found to be bunk later. But personally, I do believe that probably the Mediterranean diet is the best way to go if you were going to look for a paradigm. I also like the quote from The Omnivore's Dilemma. I don't agree with everything Michael Pollan says, but he does say, eat food, not too much, mostly plants. I think that that's perfectly fine. You shouldn't stress about how many tablespoons of olive oil you're getting that week or how many different types of vegetables you're having. Just vary your veggies, eat the rainbow, eat what you like, make sure it's real food to the best of your ability, which means minimally processed. And then just enjoy what you're eating and sit down, mindfully eat so that you don't overeat. And if you do that, you're probably okay.
That sounds like a very pragmatic and very good approach to nutrition. What about sleep? Is that something you actually discuss with your patients?
Absolutely. And this is one thing that patients definitely bring up to me, mostly because they're looking for a magic bullet or a pharmaceutical, and I disappoint them every single time.
Mm-hmm.
If you are in a lot of pain because when you stop moving, your joints hurt, it can be really tough to sleep. So I am a treat to target type of person. I do my best to try to get my patients at their goal for disease activity, but not every patient is going to get there. And it's unrealistic to think that we can remove pain from a patient's life entirely. So you will have some patients who have pain that prevent them from sleeping.
Yep.
The other thing that I will focus on is I will ask about sleep hygiene type things. So whether or not they're looking at any types of screens in the hours before bed, when is their last cup of coffee? Are they drinking coffee all day or do they stop at noon? Did they get early morning sunlight between the hours of 7 a.m. and 9 a.m.? Are they getting some natural sunlight, which I know everywhere in the country doesn't have that luxury, but getting some sunlight in the morning and then as well as in the evening time around 5, 6, depending on the time of year, can be really important to help your body get on that natural circadian rhythm. So that's where I start is tried and true good old sleep hygiene.
Yeah, and I think also, you mentioned that patients with pain have difficulty sleeping. And I think that if you don't sleep well, your pain sensitivity is also increased. So trying to get that pain under control, and if you can, as you mentioned, with medications and trying to get the arthritis and things under better control may help quite a bit. And then the last topic I wanted to address regarding sort of this lifestyle is something that you brought up in some of your comments about mental health and the importance of treating any anxiety or depression. This is a topic that's always very sensitive, like when I speak to patients about this. I wonder, what is your approach in regards to asking about these sensitive topics?
Yeah, it can be hard. Sometimes I can look on their medication list and I see that they're on antidepressants, and that can be a clue. I have the great privilege of having a stable patient panel. So a lot of my patients have been with me for 3, 4, or 5 years. I know them very well. They know me very well. And so we have a bond and an intimacy where I'm able to ask questions that maybe I wouldn't ask on the very first visit. The way I will approach it if I'm broaching the subject for the first time is I will ask people, how are your moods?
Hmm.
how's life going overall? Just a very general question. Sometimes it's easy and patients have a very flat affect. I have patients where I know no matter what I say, I'm going to get a very flat response, and it's just
Hmm.
them. And I've learned them over the years, and I've been able to coax smiles and things out of them. But so they're easy to pinpoint, but not everybody is flat and sad seeming if they have depression. And a lot of people can hide it very well when they're in the doctor's office. So as lovely as I think those little pop-ups are on my EHR, I do actually pay attention to the PHQ-9.
Hmm.
And if that does show that they had a high score, I make sure to address it with them instead of just clicking the button, follow up with PCP.
Yeah.
And then the other thing I do talk to them about, because some of our medications can make depression worse, I'll use that as a jumping off point and say, this medication in people who are already depressed might have them feel suicidal, or it can worsen their depression. Do you think that that's a concern for you? Have you ever had a period where you felt like that? And so that's one way is, to really stand behind that warning label and use that as a way to get patients to open up about it.
Yeah, I think, I find addressing mental health concerns very challenging also because of there's limited resources. So, I know patients who are depressed and we know about it and the PCP knows about it, and they're on waiting lists to be seen by mental health counselors. And in the meantime, largely their depression or anxiety goes untreated. It's a very challenging thing to address. And certainly, unfortunately, as rheumatologists, we don't have the expertise to sort of counsel them and often also don't usually provide them medicines to address their depression unless it's duloxetine to address polyosteoarthritis or chronic pain,
Yeah,
which
yeah,
may also help with
absolutely.
their depression.
I certainly do not try to treat depression in my office. What I will do, however, is in addition to strongly advising that they reach out to their insurance provider for a list of covered people who take their insurance in the area. And I encourage them to cast a wide net because since telehealth has become so widely available, California is a really big state. And so maybe in the Los Angeles area, there isn't anybody that they can see, but maybe up in Shasta or something, there's someone that takes their insurance that they could see via telehealth. So that's one blessing to come out of the pandemic. The other thing I'll do is I have a ready list of apps for the patient, and I don't think that any app can cure depression. And I don't think it's a substitute for a good mental health professional. However, I do give them a list of different apps that they can just try a breathwork practice or a meditation practice, just tools that they could cling to if they are in a moment of desperation, if they have anxiety and are prone to panic attacks, or if they get into a downward spiral with their depression and they have a way to get out of it. At least offering them that little bit of a lifeline gives them something that they can do to try to help themselves while they're waiting for other help to come.
That's great. And if you can provide us with those apps or links, we can certainly put them on our ACR on air podcast website so that, if listeners are interested, they can go there and try to get to know these apps. I wonder, as a physician, how much of the advice that you give, you actually follow yourself?
So if you asked me this during residency, I'd say probably none.
I hear you. That
you
was a
know,
busy
the,
time for all of us.
yeah, absolutely. Absolutely. I feel like so much of the life of a physician is just waiting for the next thing, is nose to the grindstone, trying to pass exams and get to where they want to be and put in the hours and do the work. And, when you become an attending physician, and I'm not saying that your life gets easier or that you have this miraculous abundance of free time, but I feel like you do have a little bit more of a modicum of control over your life. And so you're no longer, I hope, working 80-hour weeks, or as a rheumatologist, I really hope you're not doing overnight shifts or 24-hour shifts. Part of the reason why rheumatologists are attracted to the field, not the only reason, but part of the reason, is because for the most part, it allows us to work a Monday through Friday, quote 9 to 5, although that doesn't exist anymore, type of job. So, already it speaks to a person who maybe wants some balance in their life. So what I have found in my own life is that I have non-negotiables that I have set with myself. And this has allowed me to set clear boundaries with my work, with my family, and with myself. And so I think setting healthy boundaries is one way to really protect our own mental health as physicians and to allow us to combat burnout. I'm not saying that burnout is cured by going for a run or drinking a cup of tea by all means, but knowing that once the clock hits 5 o'clock, you're done with work and you're going to log out and you're going to stay logged out and you're not going to check your email. And provided that your notes are done, you're not going to log back into the EHR. You're going to take that time and you're going to be present with your family. Or you're going to go to the library, or you're going to out dancing, or you're going to do whatever it is that you like to do. And you're just going to take that time for yourself. I also really, really cherish sleep.
Mm-hmm.
And everyone who knows me knows I'm an early to bed, early to rise type of person. I like to get in bed by 8 o'clock and have a cup of tea, read my book, and go to bed. And I also like to schedule things because if it's on my calendar, I'm going to do it. So I will sign up for an exercise class. I will pay in advance and I will know I already paid for it. I'm going to go. So I'll set my alarm 5:30, I'll get out the door, I'll go to my exercise class and then take a quick shower and get to work. And then it's done. So if you do things first thing in the morning, they're done. You don't have to worry about it. I find that if I've had a really stressful day, I have to pick up my son, I have to make dinner, and then I have to do a volunteer meeting or something like that. By the time the afternoon rolls around, I have no time whatsoever for myself. So working it in first thing in the morning, for me personally, is probably going to be the most effective. Might not work for everybody.
Great. And what about food in the hospital or in the clinic? Do you find that you have things at your clinic or hospital that you can get healthy foods, or do you typically bring food with you to eat during the day?
So going back to those overnight oats, I do like overnight oats and chia pudding. And so I do meal prep. So super easy breakfast, just pop some chia seeds, some oat milk, a little bit of almond butter, some cut up fruit into a jar, pop it in the fridge, you're good to go. So you have a great breakfast that's well balanced, gives you healthy fats and protein, keep you full till lunch. I'll pack salads, I'll pack salmon, I'll pack tuna sandwiches. I mostly make food at home and bring it in. I am fortunate enough to work for an organization that does value healthful living and healthy eating. And so there are a ton of vegetarian options in the cafeteria where I work. So I do have fresh, healthful food available to me, which is great.
That's great. That sounds very tasty. All the things that you mentioned is making my mouth water a little bit. Because for me, it's getting that time to eat my lunch. So let's shift gears a little bit and talk about empathy. Also, in your blog, there was a quote from Francis Peabody from an article that appeared in the Journal of the American Medical Association in 1927 that was called "The Care of the Patient." And I think you say that your favorite quote from this article is as follows: "Time, sympathy, and understanding must be lavishly dispensed, but the reward is to be found in that personal bond which forms the greatest satisfaction of the practice of medicine. One of the essential qualities of the clinician is interest in humanity, for the secret of the care of the patient is in caring for the patient." What does that quote mean to you?
So that blog, full disclosure, is quite neglected.
As is mine. Don't worry, it happens. We go through shifts.
However, yeah, I have no recollection at all of how I found that article or even what led me to search for it. But time is not a luxury that we have with our patients, unfortunately, with E&M codes being undervalued, not even keeping pace with inflation, unless you have the advantage of owning your own practice and being a bit more flexible. If you are employed, you are being driven to see more and more patients in less time to try to make the math work. That just won't work. We're in an unsustainable system. But empathy can be conveyed in a very little amount of time. Most of us when we're talking to a patient, or I don't know if I should say most of us, but I'm sure there's a percentage of us when we're talking to a patient, we're clacking away at our keyboards and we're not even looking at the patient. We're just trying to get that note done while we talk to the patient. And that is important. Documentation in a timely manner is important. But if you stop typing and turn and look at the patient and make eye contact with them and show concern on your face, that goes such a long way in allowing the patient to feel that you've actually listened to them. Even though you might have heard everything they said while you were typing, the patient doesn't know that. And in rheumatology, especially, so much of what we do relies on the history that you really have to make sure that you're listening to everything the patient says. And if you are rapid firing questions, you're not going to hear the story that the patient has to tell you. I also use the mirroring technique where I repeat back what they say. I say, "Oh, wow, it sounds like you don't have a lot of time because your husband's ill. That must be really hard."
Mm.
And the amount of patients who tell me, like, I've never had a doctor acknowledge that before.
Wow.
Or patients who've started to cry in the exam room and I'm confused, like, "Why are you crying?" And they'll say, "Because I actually feel like you see me."
Wow.
And I'm not trying to toot my own horn or say that I'm like the best doctor ever. I'm sure that's absolutely not true. But it hurts my heart a little bit to hear patients say that I'm the first doctor to actually listen to them or to see them. And this is especially true of people who we might see as obese. I think that a lot of obese people or people who have higher BMIs than we would deem appropriate often go unseen, and a lot of them are shocked that the first thing out of my mouth isn't, "Well, you have to lose weight."
Hmm.
The other thing is, especially women often feel unheard, unseen, ununderstood, and people of color as
Mm-hmm.
well. I am not a person of color, and so I don't know what it's like to experience the world in that body, but I can listen and I can try to understand and I could try to make them feel seen. And so I think that that goes such a long, long way in creating empathy, is just, seeing another human as they are. And that also helps with my own mental health because I get the privilege of having 20 or 10 or however many little intimate moments throughout my day. And that connection to me is just so priceless.
Are these skills that you sort of brought to the table yourself, or are these things that you learned or were able to mirror from mentors that you may have had in the past?
I've definitely had some great mentors who have had excellent bedside manner. I don't know if it's just my personality. I'm kind of, I live out loud, I like to say. So I'm very expressive. I use a lot of facial, expressions and things like that. So I don't know if it's just my personality or what, but to me it just matters. And I see I see a lot of fellows, residents, medical students who are so bright and so smart, and they talk to patients though like they're looking at a specimen. They'll pick up their hand and start squeezing it without asking, like, "May I see your hand?" Just asking permission before you touch somebody's body. They're unable to step back from that doctor speak and really, explain things to people like they're humans in front of them and not a screen with an ABC question that they have to answer and get right in order to continue on with their training.
Got it. Yeah, and I mean, the data are pretty clear about the impact of empathy. I was looking through some articles that showed, for instance, people that have the flu, if their doctors were empathic, it actually changed their immune system and reduced the duration and severity of their flu symptoms. People with diabetes who had an empathic doctor had better control over their blood glucose and cholesterol levels than those that had doctors with low levels of empathy. The one thing that I've heard, I think, since medical school is that physicians that are empathic for their patients were less likely to be the subject of malpractice suits. I think, as you mentioned, it's not only that, the patients feel better and that it makes you sort of feel better as a physician, but it actually helps people heal and helps improve their medical condition if they just feel like you're listening to them as opposed to being, as you mentioned, a specimen.
Yeah, we're a social people. Humans are meant to live in packs. This is how we survived, right? All those many years ago. We are hardwired to want to find people who get us, who like us. This is something that's biological. And so that makes perfect sense to me.
Yeah, great. And then I think the last thing I wanted to address with you was the topic of burnout. I think it's become much more talked about, which is great. But at the same time, maybe the prevalence of burnout has been increasing, especially with the COVID pandemic. I was wondering if you have sort of your thoughts about this and if you have any ways of countering the burnout that many of us experience.
Yes, absolutely. I think that physicians are really fed up with people telling them that they need to just take a vacation. If you just have herbal tea, your burnout will go away. If you just meditate for 5 minutes in the
That's
morning,
right.
your burnout will go away. Absolutely not. Physicians are burned out because we have been taken advantage of as an altruistic profession, and we are undervalued, and we are not given the support that we need or the time that we need to do our jobs effectively. So I want to start with that first and foremost. So one way that I have found that insulates me from burnout feelings, not that I don't get them. My work with the American College of Rheumatology on both the Government Affairs Committee and the Committee on Rheumatologic Care and doing advocacy work.
Hmm.
I've been involved with the ACR advocacy team, I think, since 2015. And since then, I have seen tangible results of the work that not just I have done, but hundreds and hundreds of others have done. And the ACR staff who work on our advocacy team are amazing, amazing champions for rheumatologists. And if you don't already invest in RheumPack, I would highly suggest that you go right now to the website and give at least $10, because the money is used to get us in front of people who are able to listen to us and be empathetic to us and really understand how government policy affects what we do day to day.
Hmm.
Many physicians like to believe that they are above politics and that they don't want to sully their hands by getting into political squabbles and that they are high above the fray. But as a physician, so much of what we do is dictated by the government, either at a federal level or a state level. So if you take any type of insurance at all in your practice, you are involved in politics.
Hmm.
So it's better for you to be able to tell the people who are making those decisions about policy that impacts the way you care for your patients and the way that you're valued for how you care for your patients, how those policies are affecting you and what you'd like to see done. And you don't get everything you ask for. And it's certainly a marathon, not a sprint. It takes years and years and years for things to happen. But having a sense of control in your own destiny, I'll say, for lack of a better word, it definitely is empowering. And it makes you feel like the system might not be great and it's never going to be perfect, but at least I know at the end of the day that I've done everything I can to improve it.
That's great. I would have thought the opposite when people are burned out that, maybe you should take some time off of work. But what you found to be helpful for you was actually digging in and trying to address, those frustrations that you get during the day regarding prior authorizations or whatever other barrier you see in the care. That's really great to hear.
I would caution and say that if you are burned out to the level where you are not taking good care of your patients anymore, or if you're to the point where you are developing longer term mental health problems, absolutely taking time off work, working with a therapist, really examining how you can get back to a place of being healthy and being of good use to your patients is of utmost importance. But for those of us who are not quite there, who have a milder form of burnout, I would say, then at least for me, rolling up my sleeves and saying, okay, what can I do to help with this is better than taking a helplessness approach and say, oh, well, there's nothing I can do. And this is just a system that we have. And I just have to drudge away for another 30 years until I can retire, and then I'll be happy. That doesn't sound like a happy life to me. I don't want that life.
Yeah, I totally agree with you. I think the idea of sort of having a purpose, right, or a vision of how things, something that you're working towards in the future, I think certainly something that provides meaning to you can help overcome some of the challenges that we see in clinic every day. Christina, we'll definitely have links on our website to RoomPack and some of the advocacy work that you and others at the ACR have been doing, on behalf of rheumatologists and patients alike.
I hope to see some fresh faces in the advocacy world. We'd love to have anyone who wants to join us.
Great. And any parting words of wisdom before we wrap this episode up?
I would just say, take care of yourselves, take care of your patients, find something that you enjoy, and whatever you're doing, be there at that time. If you're at home, be at home. If you're at work, be at work. And that will typically improve mental health just by doing that.
I love it. Christina, thank you so much for your time. I hope you have a great and beautiful day.
Thank you. And thank you so much for having me. Hope it warms up and you get some snow melt coming soon.
I hope so too. Now I'm ready for lunch.
All right. Take care.
Bye-bye. Thank you all for listening, downloading, subscribing to our show, and for rating us with 5 stars, or however many stars you think we deserve. You can find our show notes for this episode at acronair.org, as well as on Apple Podcast, Google Podcast, Spotify, and on your favorite podcast app. Until next time, please take care of yourselves and help your patients take care of themselves as well. Of course, stay healthy.